So these are new challenges. Really, it is true. There is no doubt about it. A lot of cases we are getting, which are sometimes typical or atypical, and what exactly ultimately we end up with something else. That's what is happening. So this is the sentence which always I remember: infection-free world. That's what we thought about it. Everybody thought we can have no microbes in our world and we can enjoy our life. And this is the small statement which was quoted to Dr. William Stewart initially, but later they told it is not related to him. But it is one of the fantastic statements which we probably all of us had in our mind. It is time to close the book on infectious diseases and declare the war against pestilence one. This is long attributed to the United States Surgeon General Dr. William H. Stewart. Better somebody told it is not quoted by him, but a good one. But is it so? Can we live without microbes in our Earth's biosphere? That is the thing. So let us go and see the things. So this is the Chandu, 15 years male, complaint of fever and for 1 month. This is what we saw in the last 3 months. Continuously children having fever, very alternate. Almost we can say 2 days of fever, no fever, then another 3 days later of fever. So continuously something the mothers always prefer. Last 1 month there is a continuous fever. Though there is in between one or few days of a febrile period, they call like that one. So temperature 101 to 102 degree, cough continuous last 1 month, dry and no phlegm. This is the commonest symptoms along with the fever we saw in our practice. No loss of weight or appetite. Given antibiotics, this is the third thing we saw in our practice. Many times azithromycin, the most abused drug, and muscular was given, cough syrup was given, nebulization was given, but patient did not improve. This case, the father is a doctor and he's very well known to my close friend. So through them, I continuously got the calls to start him an antibiotic, admit him, do CT scan chest and everything, whatever, because he was so much afraid. He thought his child has got something serious diseases, which if he don't do it, diagnose it immediately, he may die. That's what his apprehension. So the patient stays in a hostel, similar episodes in other inmates. And what exactly I did in last 3 months, that just divided them as sick looking or not sick looking. That way it helped me a lot in doing a good management of the patient. So here in this child, it is not sick looking and continuous dry cough, barking like, fever 102 degree, chest occasional bronchi. And this is the chest x-ray which I got it. So, and what I am doing that one, most of the times the patient can afford because the insurance is there admitted. Most of the time I'm doing PCR of the respiratory panel for the PCR, where they can easily afford and become a little cheaper nowadays. What I got in this child is influenza A, which is detected, and H1N both are detected. So this is what is happening. That is continuously fever is there. One or the other fever, they're waiting in the queue. Okay, just imagine they're waiting in the queue to attack the child, and one is over, and immediately the another is waiting to attack, or sometimes simultaneously both the viruses attacking simultaneously. That's what we are seeing. So I just started on fluid in this time and gave nebulization with oxygen, and the patient improved within 2 days. So no question of any CTs, any other things. The father was very happy. This is the case 2. Patient had 5 years male, 1 month history of fever on and off, similar like the previous case. But what is happening is loss of appetite is there, given antibiotics 3 times. And this is the X-ray which I got. There is some amount of here, of course, in this picture may not be seen well. In the real chest X-ray, I can see that some amount of homogeneous shadow in this area. And it is sick looking. The child was sick looking. See, dehydration was there. Respiratory rate for 40 per minute, indrawing of the subcostal margin was there, no rashes, and other vital signs are stable. So admitted, and here I started straight away on injection muscular, but sent the respiratory panel for both virus and bacteria. What I got in this time, Streptococcus pneumoniae detected high level, and RSV virus is also present. So both virus and Streptococcal pneumoniae, bacteria and virus both were there, and same treatment was continued with the child, nebulization with oxygen, and the patient improved and went home. So this is the picture. Probably all of you will agree with me. In last 3 or 4 months, since the starting of June, we saw in our practice. What exactly is happening? Though we saw it as soon as the school starts, every year we do this one, but not like this way, where just giving 1 or 2 days of rest to the child emerge another virus, or simultaneously 1 or 2 viruses attacking simultaneously. So, and continuously there for 2 to 3 months, whereas we used to see for about 15 days or 1 day or 1 month like that one. But this time it is period. So what exactly is happening here? That's what even Chetan Trivedi also highlighted. So let us see. So let us go back to the COVID era of the a small flashback. Empty OPDs for the 2020 and 2021 in pediatric. In pediatric was what we saw. Empty OPDs, pediatric ward, phone calls to know how long the vaccination can be postponed. This is the one important history that we had to note down. The vaccinations were postponed. Remember this fact. No physical play, children restricted to home alone, and non-pharmaceutical interventions like masks, physical distancing were introduced, hand washing. The children went for the NPI, that is using the mask, physical distancing, and everything like that one. So end result, yeah, we were able to contain the COVID infection in the children, but and stop the reducing the spread by containing the carrier state. But what happened? Other side of the coin, what it tells, what we saw all of us, with virtually no physical activity due to prolonged lockdown, obesity increased manifold among the children. The other challenge of joint pain, poor posture, because they used to watch the online classes, lie in a different position, whatever position they like, to see the online classes. So that's what it happened. Irregular sleep pattern, as there are no schools, anything, anytime they can sleep, anytime they can wake up. What had happened, we saw in our homes also, most of the children. Mental health among children has taken a hit due to lack of poor socializing. They could not meet each other, whatever, so only through the online. So only through the online, they thought they are independent, nobody can see them, and they started bullying the things, getting bullied by others. So many things had happened. So what exactly is happening? Two things we face because of COVID reason. One is a psychological one and immunological one. Still, we are seeing a psychological thing in our children, though COVID is over. So what exactly happened in the post-COVID era? Psychological. When school started, many children refused to go to school. Mostly, many of you might have observed this one. Many suicide deaths, because as soon as the school started, the parents started withdrawing the mobiles given to them, but they were addicted to the mobiles. So when they refused to give the mobile, many threatened and in fact went for the suicide. This is the Googling I did simply out of interest. You can see so many children have died because of that one. So social activities were forgotten in the school and no social gathering, and common sense is almost nil. Talking very loudly as if suddenly calling, Amma, I want coffee, tea or milk, something like suddenly uttering in the school. So all those things of common sense were nil. That's what we saw it. And cyberbullying, which are already I told, this came in the newspaper. Either they bullied the seniors or the teacher. In fact, one of the New Delhi school teacher, they tried to enter into her Instagram, private Instagram, and posted her pictures in the thing, and she got suspended. So all of these things we have seen that one. So that is about the psychological thing. So what we forget about one important thing is an immunity depth. Remember, we are not the whole and soul of owners of this earth. We are part of the earth. So everybody has got a right to live on this earth. So what exactly has happened? We went for an immunity depth. So this is easily explained by health professor Michael Baker. If there are no forest fire for 2 to 3 years in a forest, what happened? The many barks, leaves which fell down from the trees, which got dried up. So a lot of fuel is there. Okay. So if every year the forest fire comes, the availability of the subjects for the materials for the fire will be less. Here 2 to 3 years there is no fire at all. So a lot of things are there. Once a fire catches that forest, it spreads like a hell. Almost kilometers, hectares of things will catch the fire. That's what will happen in with our children. We protected them by giving the non-pharmacological things like wearing the mask, physical distance. What exactly happened? They went for an immunity depth. Our children went for an immunity depth. For 2 years, they're not exposed to any of these viruses, which they used to get it. And vaccination was delayed, which are supposed to get the immunity, that also not there. So both the things, it affected our children. That led to an immunity depth. This is a famous article by a French scientist, Pediatric Infection Diseases Group position paper on the immunity depth of the COVID-19 pandemic in childhood, how we can fill the immunity gap. This is the famous article which has come, which has been quoted. What exactly he tells that one, there's a lack of immune stimulation is there, both by vaccination and by a direct infection. So there's a lack of immune stimulation is there. So we have a major chunk of children who are susceptible people for the infection. They're ready to get an infection. That's what we created in last 2 years. So no primary exposure and no reinforcing of the trained immunity. Both were not there. So we know repeated infection will occur, but once the infection enters our body, because the previous exposure, the child's body immunity will fight against it and kill it. Meanwhile, it will have a reinforcing of the immunity. So that is also not there. So both things were not there in our children. So this is the thing, probably all of you know it, lack of time. Let me skip this slide. So training is not there. So what exactly is that? So few things he quoted in the news, in that article, that is varicella. We know varicella commonly occurs. So what happened? The children were not exposed to the chickenpox. So these children grew up. So when they grew up, we know more the age of the child, more the severity in the child. So if a chickenpox comes in that child by chance, the severity will be more. So, and people who are exposed, ready to expose to varicella are also increased. So both things happened in this time. Same thing in the RSV. So in the first 6 months of COVID-19 pandemic, the initial epidemiologic data from the southern hemisphere showed almost virtual absence of the RSV infection. So remember this fact. And same thing with the rotavirus and enteroviruses. Remember how our OPD was filled with an HFMD in the initial 2 months of June and July. Every alternate patient probably we had an HFMD. So whereas during the COVID period, we didn't have such children. So this is the fact we are seeing that one. And streptococcal pneumonia, this is an important thing by work of Gray. He tells that one, all infants will be colonized by various serotypes streptococcal pneumonia in the first years of life. Most of them progressively develop mucosal and systemic immunity against these various serotypes without showing clinical signs of infection. This is an important fact, we always know it. What exactly in these 2 years that one, they were not exposed to the streptococcal pneumonia at all. So there is no, even a subclinical infection is also not there. So no immunity. So they're ready for a infection later. So, and we know pediatric pneumococcal carriage and infection are favored by a viral infection. A post-viral situation is the best time for the streptococci to attack the children. So here we have got a major chunk of children who are ready to get exposed to the streptococci pneumonia. And most of the time, what happened, we know the immunization program, because the health workers were shifted to managing the COVID things, and many materials also went there. Even in fact, our gene expert hardware also went to test for COVID RT-PCR, and most of the doctors also went to manage the COVID patient. So everything we ultimately led to a chunk of a greater chunk of children who are immunity dead. So what happened? So let me see what happened in my hospital. For about 3 months or 2 months, I did RT-PCR in children who got admitted. So there is from June to end of August, 84 cases. Number of positive cases were 73. So positive percent was 86.90%. And double infection was in about 19 cases. That is the thing. And remember, neonate 1 month to adolescent. So as the age increases, the number of infection we got more. That's what thing I told in immunity depth. So we have got children who are ready to get infected, and as the age increases, we got the more people who got infected. So, and this is the coming to the microbes who affected more. See the big man here. So that is the influenza A. So almost 33% of my cases were influenza A. The next one was H1N1 was 17.9%. And the third were human influenza, human metapneumovirus, 10.7%, and human respiratory syncytial virus of 10.7%. These are 3 viruses which dominated since last 2 months. Probably maybe same situation with you people if you have tested the same thing like that one. And So what the data shows? The data shows almost more than 95% of the cases were of viral origin. This is an important statement I want to do. Why unnecessarily the antibiotics were started in almost all the cases which are referred to me in our hospital. But the antibiotic never helped them. And in same cases, when I did the RT-PCR, when I did the PCR test, most of them viral in origin. So the more major four viruses were influenza A, H1N1, RSV, and metapneumo, and isolated bacterial infection almost nil. So it is the time, the festival for the viruses to get attacked. So what you call the Mela of viruses initially. So the bacteria was almost nil. Only 2 to 3 cases I had bacterial infections. So most of the cases were prolonged in nature, lasting 2 to 3 weeks. Or already I was told there was in a queue to attack any child. After you, me. That's the way they're behaving like that one. That's the way I can explain in that one. And cough persisting in majority of cases, and the main concern to get admitted. And antibiotic was never used. Azithro was a main abuse drug. And RT-PCR really helped me to managing the children more comfortably, more confidently, and almost advising the parents of the same thing, because almost for weeks together, children were attacked. So they want to know what exactly is happening to their children. They were apprehensive. And the RT-PCR helped me to allay their tension and anxiety, and also for me to give a good confidence. The immunity depth has created a new scenario where the child is getting infection very frequently, no recovery phase for each infection. So we have to be watchful for other vaccine preventable infection, because the vaccination has been postponed. And in this same 2 to 3 months also, because the continuous attack of the fever, the parents were not willing to come to our clinic to get vaccinated. So it's almost a postponement of the things. That's what has happened. So before concluding, let me go with another interesting case. So not only the children, the neonates, the 40 days old child, history of fever, cold and cough for 3 days, admitted outside for respiratory distress, started an amoxicillin for 2 days, then changed to Pipras. Patient was on 5 liters of oxygen, no improvement, referred to us. And when we examined, baby was in severe distress, respiratory 75 per minute, saturation 88%, tachycardia tachycardia 170 per minute, indrawing of subcostal, and total count 11,000. Remember, the patient is affected so seriously, but a total count just 11,000, and neutrophilia, and CRP is slightly high, 35, and this is the X-ray. This X-ray probably you can see on the right side, some patches were there. So initially we thought it is a bacterial, and we started an antibiotic, and this is the ABG. And ABG, look, it is very high. This is an acidotic time. So we started the patient on volume mode on ventilation, changed to antibiotics, ceftriaxone because of the X-ray, baby worsening, and needed pressure mode with high PF. So went on worsening even on ventilation also. So CRP increased from 30 to 50, and TLC remained the same. This is an important thing which we have observed it. And when we inquired, once again we took the history once again, we came to know the baby had fever even before this incident also, remained afebrile for 2 days, had fever for 2 days, then disappeared. And COVID antibodies, IgG antibodies, we did that one. Ferritin, LDH, BNP pro were raised. BNP was almost 3,900. It went up to 9,000. Echo of the cardia was normal. So we thought of a MISI in this child, and started on steroids and later IVAG. After that, starting on IVAG, baby started improving by ventilation wise also, and developed frequent bradycardia. When we did the Holter study, it had arrhythmias in that one. So the COVID has affected the myocardium. And finally, baby are able to put the child off the ventilation and went home. So there is something going on along with the sepsis and other metabolic disorders. You have got one more DD in newborn, even up to the age of 3 to 4 months, the MISI in the child. And this is the beautiful child sent by Dr. Maitri, who has managed almost 20 cases in our hospital, Manipal Hospital, neonatal MISI. This is the beautiful slide sent by her. And it is a thing we have to keep it in mind. That's all I can tell about this one because of the lack of time. Finally, as Lord Trivedi told, there are so many cases which are coming, we don't know what exactly is happening. This is what I felt. I had one case, similar cases. 8 years old girl referred to us, history of fever 2 days duration, vomiting 2 to 3 times. Outside examination, revealed patient in shock, pH of 6.9, lactic acid of 12, acute is cold, given bolus IV 5 times, no recovery, and referred to us. Our laboratory report told TLC of 24,000, CRP of 60, hypotensive, irritable, bleeding, not stopping at the IV puncture site. Even there also it was bleeding. Platelet count just 17,000, liver enzymes elevated in 1,000. Dengue came negative, and patient died within few hours after referring to us. So finally, let me close my talk. So infection fever. So you all of us, we thought about it, and we dreamt of that one. Please remove this statement. Okay, we had to live with this. This Earth biosphere has got a place for all, including the microbe. A healthy, meaningful, and practical equation among all is a more pragmatic approach, which includes avoiding antibiotic abuse. Any antibiotic abuse, believe me, you are building a group of bacteria which are resistant to it, which may remove us from this earth, remove this fact. We are not removing them, they may remove us. So start avoiding, the antibiotic abuse, stop that one. A robust immunization service and surveillance setup is an important thing. Anytime this never to be, we never be failure in this giving a good immunization service, what we did during the COVID time. Okay, thanks a lot.